Happy Monday. Let's talk about some cuckoo plastic surgery news. In Queens, New York, Felipe Hoyos Ferronda, who's 38 years old, called 911 after a patient became unresponsive in his care. And when I say in his care, I mean he was doing surgery on someone in his house in Queens, New York by himself. So after calling 911, he fled the scene. The emergency responders found the patient in cardiac arrest, brought her to the hospital, but unfortunately she was not able to be saved. So they figured out who Felipe was via his landlord, and they used license plate readers to find his car. And he was on the way out of the country, and he was apprehended at JFK Airport on the way to Colombia. He claims he was a licensed doctor in Colombia. He has no licensure here in the United States. So I talk a lot on my page about how to properly vet a plastic surgeon that you're considering going with for a procedure. Number one is always to vet their credentials. You want to make sure that the person you're seeing is licensed in your state, has done the proper training in plastic surgery, and holds a board certification by the American Board of Plastic Surgery. If this patient would have done that, they obviously would have found this person is not licensed in the United States and does not have a board certification. So after you vet your doctor's credentials, it's important to find out where do they operate. They need to be on staff at a hospital. Even if you're having surgery at an outpatient surgery center, you want to make sure that your surgeon is credentialed at a hospital so that if you need to be transferred, they will go with you and care for you there. If you're having surgery at an outpatient surgery center, you want to make sure that they have a proper up-to-date accreditation. And then it is possible, of course, to have minor procedures and in-office operating suites, but these are not appropriate for major procedures. So it's important to discuss with your surgeon where is the surgery being done. In this case, this is in some random guy's house that he didn't even own. That is never acceptable. I know a lot of people are desperate to have these cosmetic procedures, but it's always important to consider that part of what you're paying for is the expertise of your surgeon, and that's what keeps you safe. So certainly this person, I would imagine, is quite inexpensive, but this is what makes it not worth it.